Hello, everyone, and welcome to our joint press conference addressing the COVID-19 pandemic in Knoxville, in East Tennessee, and in the state of Tennessee as a whole. We want to thank you for joining us today. Thank you to all of our participants, our public officials, our members of the community. Thank you to those that are viewing and to the members of press that are on the call today as well. We will begin today by hearing from our elected officials. Then we'll hear from a few citizens impacted by COVID. And then public officials will be available for questions. So first, our first person who will be speaking will be Commissioner Courtney Durrett from District 2, Knox County Commission. And so I will hand it over to Courtney at this time.
Hi, thank you, Matt. Thank you for everyone that is here today and following along on Facebook. We are in a dire situation. Currently, in the past 2 days even, Knox County has had an increase of over 1,000 new coronavirus cases in 2 days. 580 something on Sunday and 500 and something yesterday. I cannot begin to express my worry for Knox County and for the residents in our community. I want them to be safe. And the way I feel like that we can do that is to keep our Board of Health and to commend them and to support them and to give them what they need in order to help keep our population and our community members safe and healthy. You know, this is a pandemic. This is a health crisis, and it's nothing more right now. But somehow we've kind of turned it into this political divide that shouldn't have happened. We need strong leadership. We need more than just one person. We all need to stand up and do the right thing. And I say that because my family personally now has, while we do, of course, we all have a risk of catching COVID. My daughter has an autoimmune disease, and she was just diagnosed with that a few months ago. And so this hits us especially hard. If she were to get sick, who knows what could happen? The greatest risk we run of catching this is from those who ignore taking simple precautions, following the 5 core actions. I do respect their decisions not to wear masks, but what I don't respect is they're putting me and my family at undue risk as a byproduct of them exercising personal liberty. Because of this new potentially fatal autoimmune disease, of course, it's mine and my husband's responsibility to take care of our daughter and to protect her. But it is also other people's responsibility as well. Her classmates, her teacher, her principal, the school system in general, the government officials, the community, and even those who protest all of these things. I feel like we've learned a lot about ourselves and our community because of COVID-19. Some of it is good and some of it not so much, unfortunately. The Board of Health needs to be commended for what they have done so far. They have been thrust into a situation that they did not sign up for, just like we haven't. So we need to keep that in mind as we go about our daily lives. We need to keep everyone's story in perspective. You know, people are coming from different perspectives, and we need to keep that in mind and top of mind. And that's pretty obviously lacking in our is that commitment from the rest of us, the commitment of civic responsibility and commitment to something bigger than ourselves, the commitment to each other as friends and neighbors. It's lacking, and it's unfortunate, and we need to come back to that. There are times when personal liberty are important, but there are times when it must give way to the greater good. And I feel like this is one of those times. And so we really just need to come together as human beings and really listen, put our differences aside and try to come to some kind of common ground here, because we are in a dire situation, and I'm afraid it's only going to get worse before it gets better. And so this is kind of my plea to our community, is to let's support each other. Let's not be divisive.
Thank you very much, Commissioner Durrett. And now we'll have Commissioner Lundy speak.
Thank you to my colleague, Commissioner Durrett, for your wise words. I will piggyback off of you. I know we're all experiencing COVID fatigue. I definitely am experiencing it. I never had a break, even during a shutdown. I'm a healthcare worker. We were just thrown in there. We didn't know what to do. We didn't know what equipment we need. We just got our masks and just kept going with a lot of anxiety, not knowing if our patients had COVID, because hospitals started dumping out. Let me use it because I'm using my healthcare language when I say hospital dump. A lot of discharges, and then they come home with a lot of breathing problems. So it created anxiety for us because we didn't know they had COVID or what, because they wasn't really testing. But it has been a trying year for myself, trying to run for office and also still working. My patients this last few months, we have had an increase in COVID cases that I'm seeing. And I always ask, like, how did you get it? And people are just not paying attention to the guidelines. I posted a story on my Facebook, I guess a month ago. A couple went to church because they got tired. They want to see their family, and I understand their church family, their friends. It gets lonely at home when you don't have anyone else, and they want to get out. And from that encounter, 40 people contracted COVID on one Sunday. And since then I've discharged those people. So I don't know if there was one person that was on the ventilator out of that 40 people. So I don't know if that person has passed or survived. But I'm also treating someone right now. Her she got tired too. It's just kind of, you obey the guidelines, and then you kind of got relaxed, and then she ended up getting it really bad and was in the hospital for 3 weeks. And when she came home, she couldn't walk anymore, and it has been a struggle to get her back, but she's almost there. I just want people to know that this is serious. It is a real disease. I see it. I'm still trying to figure out how to treat people with it because everyone is so different. But I do know, even though what you see on the news when people say that the data said they recovered may mean that they're not contagious. But as far as the side effects, the impact that has on their body, a lot of people I heard have blood pressure problems due to COVID, of course, increased respiratory problems, long-term oxygen. It's so much that we don't really know. But I just really want to encourage everybody to just not get COVID fatigue. I know, I understand it. I understand how it wears down your mental health, but we definitely have to figure out how to unite around this and respect each other. I'm tired of Democrat, Republican, mask or no mask, or border health or no border health. Let's come together as a community and win this thing. And COVID is the enemy. We are not each other's enemy. COVID is the enemy, and that's the common enemy that we have to come together to fight, and then we can move forward. But as far as the Board of Health, I don't think this is the time to discuss whether or not we should have a Board of Health or not. We're in a pandemic, and people are dying. So I just hope that I just want to encourage everybody first and foremost, but really just respect each other. I know people get mad at each other and we call people names. Let's stop doing that. Let's humanize people. Everybody has a right to their own opinion. If you don't like their opinion, just walk off and turn your cheek and go the other way. But this divisiveness, we will never get out this pandemic because we have become so divisive and so and harboring so much hate in our heart. And I hope that we stop. That's all I really have to say right now, but just stay encouraged, everyone. Thank you.
Thank you, Commissioner Lundy. And now we'll turn it over to Representative Gloria Johnson. Oh, you're still muted, Gloria. Hold on just a second.
Okay, sorry about that, because I thought I had myself unmuted because there's no noise in my house. Anyway, it's really a sad day in Tennessee when extreme partisan politics becomes a higher priority than public health. Public health is not a partisan issue. Asking folks to wear a mask is not a partisan issue. We're Tennessee volunteers. Wearing a mask to protect our neighbors is not too much to ask. Governor Lee, he's in over his head. He's demonstrated a complete failure of leadership. He's the only person in the state who can make the decisions that need to be made to save lives, and he refuses to do the job. We received an early batch of 975 doses of the vaccine yesterday. Rather than getting that straight into healthcare professionals' arms, we're holding it in reserves as a backup. That doesn't make sense to me. I was at a briefing with Unified Command, and there was no mention of this batch of the vaccine that was going to go into a reserve. They talked about it going straight into the medical professionals' arms. And so I'm not understanding that at all. We have got to have leadership in order to contain the virus. We just found out yesterday that Tennessee has moved to #1, having the highest rate of virus spread in the world. We have ER doctors calling across Tennessee and surrounding states looking for ICU beds for their patients who need them. We have physicians in the news begging for Governor Lee to take action, begging for him to have mask mandates for adequate testing and contact tracing. He's responded by doing nothing. No mask mandate. He's actually reducing the amount of testing, which is counter to the health experts, what they think is necessary to keep a handle on exactly how widespread the disease is. And there's virtually no contact tracing at this point. These doctors have continually asked him to come and visit their hospitals, and he has refused. Even in Knoxville, it's my understanding one of the commissioners visited the hospitals. You know, if the governor can't even bother to go and visit and see what these doctors and nurses and hospital staff are going through, it's remarkable to me that is where they are. They're exhausted and they're begging for help, and they're being ignored by our leadership. They're medical professionals. If you see them posting videos, you know, they get nervous. They're not typically political people. Doctors are not political at all. But to see so many of them speaking out, they're exhausted and they're tired of watching their patients die when it didn't have to be this way. They've been warning us for weeks, making recommendations that would contain the virus, and their pleas have been ignored by someone who can do something, Governor Lee. We still have hardworking Tennesseans waiting weeks or months for their unemployment. We have hundreds of millions of dollars not getting in the hands of families that desperately need them. We've got teaching assistants, teachers, and now I hear of a principal dying after being forced back to work in their schools when it's not safe. We have a vocal few questioning the authority of our public health board during a pandemic, authority that is clearly given to them in our state code. I'm willing to bet these same folks who go to a doctor when they get sick, why aren't they listening to those doctors now? This is an example of extreme partisan politics getting into our public health where it has absolutely no place. Why is a Knoxville legislator trying to change the state code by taking away support for our health boards in a health emergency during a pandemic? We've never needed those folks more. We cannot take away their ability to mitigate the horrible circumstances we find ourselves in this pandemic. For them to do that it's anti-science and it's anti-community. We're volunteers. Let's put the partisan politics aside and let's do what is right and what is important for our community before we lose more members of that community. Thank you.
Thank you, Representative Johnson. Now, Representative McKenzie.
Thank you, Matt, and thank you for the press. And you know, the good and bad thing about going last is that the points are there, and you've heard a dynamic set of reasons and causes to urge our governor and government to mandate mass usage. You know, while I was on the campaign trail, and I caught a little flack for it, I supported Governor Lee's easing of the restrictions in our, public facilities, restaurants and whatnot, because the data said that. The data drove that decision. The trending was, it was low compared to where we are now, but it was trending in a downward fashion. But I said, and I was clear, let's keep measuring. And that's what did not happen. It became political at that point. So instead of continuing with a data-driven decision process, politics got in the way, unfortunately. And now look at us. We just zoomed past the 200 death case. We're at 218 cases. We have a small percentage of our ICU beds available. Again, last week and week before, we had to send people out of county, out of state, because of where we are. It's raining, it's pouring. It's time for leadership to step up and just make decisions. Make decisions based on the current state of affairs. There's a series of pictures that are out there that shows what a sneeze looks like without a mask, what a sneeze looks like with one layer, the gator kind of mask, face protection, single layer, double layered, and a surgical mask, and then just a cloth face covering. Ladies and gentlemen, there are factors from that 2-layer gator through the surgical mask, through the face cover. There's order of magnitudes different. They're just different. That sneeze goes out meters and comes in contact with unsuspecting people and surfaces, and it stays there for a while. This makes sense. This is reality. This is what's happening. This is why our cases are growing, because we're allowing things to spread. We're allowing ourselves to go into places and to stay in places that we shouldn't be in currently. So, as we move forward with this, as we continue this fight, and it is a fight, it's a battle. We knew, everyone said, Republican and Democrat, there's going to be a Thanksgiving surge. With that said, we're living in a Thanksgiving surge. So we know what happens when we start to come in close contact, when we start not to wear our masks, when we start to get close and interact with people from different environments, we're going to get a surge. And this surge is going to lead to hospitalizations and death. So again, my colleague said it all, but I just urge this governor, I urge this mayor, Knox County mayor, I urge my fellow representatives that are trying to undo the Board of Health just to stop. Let's just stop right now. Let's make informed and wise decisions going forward. Or let's not make any decision. Let's stay the course from a Board of Health standpoint. Let's try a mask mandate. Let's measure. Let's try it for 30 days and then measure again. And let's see what happens. There's an old adage, and I'll leave with this. Your ability, your rights stop at the tip of your nose, or your rights stop at the tip of someone else's nose, or your right to swing your fist stop at the tip of someone else's nose. We're beyond that now. With this virus, with the spread of this virus, I myself have, if I was positive, have the ability to infect hundreds of people. In our professions, thousands of people. So this is a public health crisis, and we have to take bold steps. So I just encourage our governor, I encourage our county commission, House of Representatives, just to stop. As Commissioner Lundy said, stop with the politics, make informed and wise decisions, because people's lives are at stake. Thank you.
Thank you, Representative McKenzie. And now I'll hand it over to Sam Brown, who will introduce some of our next participants.
Thank you very, very much, Matt, for this opportunity. Our elected officials who are with us, not only do they have the leadership, but we have today persons who have experienced firsthand the adverse effects of this COVID pandemic. And these are citizens right here from our community. So first up, we have Ms. Katie Allison, who's going to speak to us about the long-term effects of the COVID disease.
Good morning, and I see from my picture that I've got the sun shining directly on me, so I hope my picture is clear enough and I don't just look like a burst of sunshine. But anyway, my name is Katie Allison. I'm a married mother of 5 children. I live in Fountain City, and I contracted COVID in July, late July of this year. And the best way to explain my situation is that I have been functionally incapacitated since that time, since I contracted COVID. Like most people, the disease is so new to the human race that we're learning about it all the time. And like pretty much probably all of you, I was told when I contracted COVID that the possibilities were these. I would either be asymptomatic, I would experience, the mild sniffles or some mild flu-like symptoms for 2 to 3 weeks, or I would become so sick that I would need to be in the ICU on a respirator at risk of death. In fact, there's a 4th option that's just, as the months go by and we learn more about this virus, the 4th option is this, that people who catch COVID, many of whom have no specific risk factors, which I did not, are being, again, functionally incapacitated by ongoing post-COVID symptoms for months and months and months. In my case, I've never hospitalized, but I was the sickest I've ever been. I was so sick with COVID for 6 straight weeks that I literally could barely stagger to the bathroom. I've never experienced anything like it. Following the 6-week period of active COVID infection, and by the way, no contact tracer ever called me. And I was given my positive test at a local hospital, never heard from anybody. Anyway, after my 6-week initial infection, I thought I was all better for a couple of days. And then wham, I was hit with a huge array of bizarre, random, and seemingly baffling symptoms that my doctor and now my doctors say they're seeing more and more of in post-COVID patients. The idea that viruses can cause long-term post-infection symptoms is not a new one. You've heard of people being sick with mono for a year. Epstein-Barr virus can leave you with chronic fatigue syndrome. Ebola, which I didn't know, apparently has a high rate of post-infection symptoms. And the SARS viruses, of which COVID is one, also appear to have a high rate of post-infection symptoms. And again, I'm sitting up now. I'm really in the last week kind of feeling a little better, but I literally can barely sit up without passing out. I had to be taken to vote in a wheelchair because I could not stand up. And again, I was a perfectly healthy, active, and productive person before this happened to me. Anyway, what I would like to say is that without, my elected officials who've already spoken and whom I respect so much, have already made clear just how bad the problem is in Tennessee. And in my opinion, Governor Bill Lee's failure to act goes beyond partisanship, which it certainly is, and has become an issue of basic governance. He simply is failing at basic governance at this point. Knox County Mayor Glenn Jacobs, on the other hand, has engaged not just in passive opposition to basic public health measures, but in actively antagonistic, agitating ways to try to stop public health measures. Tennessee is being left tragically with so many deaths due to COVID, and we're hearing a lot about that. That's obviously the worst possible outcome. But Dr. Fauci now estimates that up to 10% of COVID patients who are never hospitalized, and many of whom never had any risk factors, go on to experience disabling post-COVID symptoms. I encourage all of you to Google the term long haul COVID, because that's what it's being called now. The media is starting to pay attention. The infection's been around long enough that we're now seeing the symptoms. And Tennessee is not only going to be left with a wave of death and destruction and tragedy in that way, but we're going to be left with an entire population of previously healthy, productive folks who are to greater or lesser degree disabled. In my case, I work in media and communications. I had to significantly cut back on my work. My children have essentially been deprived of a mother for the last 4.5 months because my husband has had to do everything. And again, I've never been so sick in my life. I cannot encourage Governor Lee enough to mandate very basic, simple public health measures. As I often say, is it really a violation of your liberty to be asked to throw on a quick cloth mask while you run into Walgreens for a tube of toothpaste? I mean, come on, that's not a violation of your liberty. And if people would put as much effort toward fighting this raging epidemic in Tennessee as they're putting towards having to, wear a mask for 10 minutes while they pop into Kroger for a bell pepper, we wouldn't have the problem we have today. Again, Governor Lee's problems at this point go beyond partisanship and are an issue of basic failure of governance. And I'm one of the victims of that. My family has been completely upended by it, my work, my mothering, and I encourage, while the deaths we've experienced are obviously the ultimate tragedy, please know that many of us are also being left with long-term disabling complications from this terrible virus.
Thank you so much, Katie, for sharing that with us. We realize how much courage it took for you to do that, and we are certainly keeping you in our thoughts as you continue to recover in the days to come. Thank you very much. I
truly appreciate the opportunity to speak.
Thank you. Next, we have Ms. Phyllis Shea, who lost a loved one to COVID.
Hi. My name is Phyllis Shea. Thank you for allowing me to tell my story. My mother died from COVID in September. She was in great health for a 93-year-old prior to developing it. She was a resident of an assisted living facility in Florida, and the facility locked down fully 3 weeks before the governor did the state mandate. And I think that since they locked down in February, this really enabled them to keep their residents safe all the way until mid-August. We think what happened was that my mother's former roommate had a doctor's appointment, and that's how she contracted it, and then spread it around the facility to several other people before it was caught. Mother was admitted to the hospital, and I was able to FaceTime with her on the second day, I believe it was. She looked and acted like herself. She was complaining about the food, so that was just like my mom. The hospital released her after several days to a skilled nursing facility because she wasn't allowed to go back to her home. And over the course of the next several weeks, her condition worsened and she eventually died under hospice care. And all I kept imagining was her being alone and confused about her unfamiliar surroundings with strangers who looked like space aliens hovering over her. That was very upsetting and emotional for me. I feel sad she was alone during her illness except for the medical staff. I was unable to visit her, to see her, hug her, kiss her. I knew for at least a week or so that she was in the process of dying. That is really hard to deal with and not be able to be there. I was also sad that I was unable to fulfill one of her last wishes. She wanted to donate her body to science. We had her all signed up with an organization, and unfortunately she still had the virus. She was still testing positive when she died, and none of the organizations that I had contacted would take a COVID positive body, so we had to make other arrangements. So against what her final wishes were, I was not able to fulfill. I feel angry that the pandemic became politicized and expert medical and scientific advice was ignored, still being ignored. I feel frustrated that people still don't believe this virus will affect them personally. As I'm out and about in Knoxville, I see many, many people wearing their masks improperly or not at all. I wish others knew that this virus is relentless and rips apart families. I wish people would know this is not some political conspiracy. This is not fake news. It's killing millions of people worldwide. Those it doesn't kill are either directly affected by them or a family member surviving, or the long haul syndrome, or by its economic impact on them. Everybody's being affected by this. As time goes by, we are discovering long-term effects. Some of them include things like loss of cognitive functioning. That's pretty scary. I think that we should all follow the CDC guidelines and stop politicizing mask wearing. I don't understand that at all. We should get the vaccine when it becomes available. We should get it to become available and have our political, our state leadership and actually distribute the vaccine. We should learn many lessons from this, and first and foremost, to listen to the medical and scientific experts and follow their advice. Thank you for allowing me to speak.
Thank you so much, Ms. Shea, for sharing the story with us. And we, once again, as well, keep you in our thoughts as the days progress, as you continue to deal with the adverse effects of this pandemic. Well, luckily for us, we have a community that is full of such resilient personalities that when persons who are supposed to be charged with serving and leading us fall short on the job, as Representative Johnson put it, we have persons in the community that can step up, that will use the talent and the resources that they have to help mitigate the effects of this pandemic. So we're so glad to have us Miss Cynthia Finch, who is a great community leader and is going to speak to us about the wonderful ways that the community is coming together to help alleviate some of the suffering our citizens are experiencing from this COVID pandemic. Ms. Finch.
Yes, thank you, Mr. Brown, and the sponsors of this opportunity to share. I'm excited about the opportunity just to be here. Once again, I'm Cynthia Finch. I am a licensed social worker. I'm a volunteer and program manager at the East Knoxville Free Medical Clinic that's located at 2700 Magnolia Avenue, and I work with the clinic at the Greater Warner Tabernacle Amy Zion Church at 3800 Martin Luther King here in Knoxville. One of my biggest volunteer prides is the work that I do with the Faith Leaders Church Initiative that came about because of the fear of churches opening up prematurely and people possibly getting contracted with this virus. So out of that whole piece, ever since May 1, we have been meeting every Thursday for 1 hour by conference call with the subject matter experts that come to us and talk to us about many topics. So now we feel like that our faith community is empowered with all types of information to not only talk to their congregation, but talk to the people in the community. I'm so proud that I have Vice Mayor Gwen McKenzie, who also serves as one of the co-hosts, and a lot of our sponsoring organizations like Connect Ministry, Ms. Vivian Shipe, that's the Voice of the Voiceless, and then my program, which is New Direction Healthcare Solutions. I wanted to also share with you today about the fact that I am a clinical trial participant. I've been in the trial for about 3 weeks with no side effects, and there may be a little slight headache, but it went away very quickly. And I call myself a person of action. I say I'm a person of action because in order to begin to talk about this resolution, which is the vaccine, I've shared with others that my disappointment in things that's been going on about the vaccine is they've been talking about the vaccine, that it's coming, it's going to be delivered, how it's going to be stored, who's going to get it, tiered. But we have not had an organized, what I call an organized communication campaign about the vaccine so people can understand it, they can be informed, and then they can decide one way or the other whether they want to participate in it. So once again, a woman of action. I put together called Impact. It is an organized communication campaign that provides messaging. It informs about the vaccine. It's information about how the vaccine will impact people physically, mentally, and all other kinds of ways. It also has a boots on the ground component where we will be out in the community, all over, underserved, under the bridge, in the rural communities, passing out information about this vaccine, because that's what people need. They need to have information to inform them. We want to educate them. We want to talk to them. We want citizens to know about the vaccine. So we need messaging. So you elected officials that's on this call and the media, I want you to know that not only do we need to be talking about how it's going to be distributed, not only do we need to be talking about how it's going to be stored, we need to be talking to individuals, people that trust other people about the vaccine. You know, how's it going to be, how's it going to go in your arm? I can just tell one brief convincing story. I said to my sister, you work with a Head Start. What is one of the things that has to happen in order for kids to come to school? And she said, oh, yeah, the parents have to come and sign. She said, and then they have to bring their shot record. So I began to say, stop right there. A shot record. We're talking about their measles shot, their mumps shot. Oh, yeah, what about the flu shots and the shingle shots and the pneumonia shots? Then I said, this vaccine is in that same category. It is to address this dreadful covert pandemic that we have. So as people think about their shot records, and we have one more item to check off, shot records. So to the media, to the community, let's begin to talk about what we can do that is action oriented, such as the fact that this coming Saturday from 10 to 4, we will be having testing at the Greater Warner Tabernacle parking lot. And I'm telling everybody, it's here in Knoxville. This is probably going to be the last community pop-up testing that will happen before the holiday season. But yes, the health department continues to provide testing Mondays through Fridays from 9 to 3, but community pop-ups has been lacking. And as Representative Gloria Johnson just talked about, that we don't have enough testing, and I am a true believer that we need to do more testing. Our state government needs to provide resources. We need the Department of Health to be out in all communities providing testing. We need the community to come to testing, and we need to do more contract tracing. So lastly, I just want to say an open, big thank you to our Knox County Health Department, to every hospital facility, to Dr. Gray, who has been a warrior and a champion in this community, and to our faith leaders initiative. That's over 100 plus churches that come together on the telephone on every Thursday from 5 to 6 to listen to the topic of the day. So this coming Thursday is all about vaccines, Pastor Brown. It's all about vaccines this coming Thursday. And if anybody would like to join in on that call, I'll drop it in the chat box so that they can get the call-in number to come to a conference call of action. Once again, VAC Impact is the organized communication outreach push to talk about vaccines, a message that individuals can trust. But we're doing the work. We're boots on the ground.
Thank you so much, Ms. Finch, for the continued work that you do in our community. For our last speaker, we have a very powerful story from Ms. Ann Hewitt Worthington, a member of our community who lost her husband to COVID. A very compelling and powerful story. So please, Ms. Worthington, share with us. And after Ms. Worthington, we will have questions from any of our media persons who are with us. Ms. Worthington.
Thank you, Sam, and thanks to all our public officials and other concerned people who joined us today. This is going to be my first Christmas and holiday season without my husband, although he's here. He is a decorated Vietnam veteran of 3 tours. He is right here waiting to be buried at Arlington National Cemetery next year. Just what Jesse Worthington grew up in North Knoxville. He came back to Knoxville after a 26-year career in the Air Force. He worked for software companies that made the cloud happen, going back to the 90s and the 2000s. He's a graduate of UT with a bachelor's and master's in business. He went to Fulton High School, and he was 100% Agent Orange, totally and permanently disabled veteran. He was in assisted living, and as his health deteriorated, we really hoped that he would not get COVID, and I fought against it. I stopped seeing him even before the facility locked people down, so he wouldn't get it. I didn't want to be a vector. I didn't want things to get worse for him. The staff were terrified, the healthcare workers. They had no PPE. They were terrified he would get it. They were terrified they would pass it on to him. It was a very difficult time in March. And by August, he had some other health problems and had to be transferred around to different healthcare facilities at the end of August and into early September. And somewhere along the way, and there were contact tracers, but he did contract COVID. He was being discharged from a healthcare facility on a Thursday. They were planning it. They tested him. They didn't get the results back until the following Monday. They couldn't transport him back to his assisted living until the next day, Tuesday. And Wednesday of that week, he had symptoms of COVID. So they tested him again twice. And then the question was, what are we going to do with him? Talk about gaps in the healthcare system. Where do you put a disabled veteran with heart disease and dementia who has COVID? His suffering was terrible, and we didn't know how to treat him. Fortunately, we did get him into a hospital in Knoxville where they took really great care of him. We thought he was going to be getting better. We thought the Tuesday after Labor Day, I was talking to the discharge team because he was responding so well to treatment. He had terrific care from a physician who was a contract hospitalist who was working 11 days in a row, and then he'd have 7 days off. But we did have great care. That being said, the Wednesday after Labor Day, his condition completely tipped. And by Friday, September 11th, he died alone. This is a man who was the most selfless man I have ever met. He flew into hurricanes. He rescued downed pilots in North Vietnam. He had 8,000 hours of flying time. He was a real hero. His daughters and I were not able to be with him at the end. In fact, I hadn't seen him for 25 weeks before he died. Right now, we have one of the daughters who is a teacher. She does not have good COVID protections in her classroom where she teaches. We don't want to have another loss in our family, but she's at risk. Her mother is at risk. I'm not her mother, I'm her stepmother, who is elderly. We have another daughter who works at home who is having a very hard time with the isolation that COVID has brought to protect herself, and she grieves alone. We were not able to have a funeral in the normal way with my husband's family, who are scattered across the area here, and his fellow Fulton High School graduates and UT colleagues and so on, his professional colleagues. We couldn't even bring ourselves to have a local funeral and have people gather, because how can you have a funeral and invite people to share their grief when the person died of COVID, which is contagious? You don't want to have a spreader event. So it's been very, very difficult all around. And what I would like to see is, I would like to see a governor who is responsible, and other healthcare officials and legislators, and Gloria shouldn't be carrying the water on all of this, and people who are involved in the public sector who can make a difference in terms of policy and in terms of getting people to wear masks. The first week in July, before I went to New York for major surgery, I wrote to the governor as part of that letter writing and phoning campaign to the governor to mandate wearing masks. We could have prevented these deaths. We could have prevented these large numbers of deaths. I was up in New York in the middle of July. It was shut down. Everybody was wearing a mask. Nobody made it a big political issue. Everybody wanted to protect everybody else. And then I came back here and people were acting like nothing was going on. It was still going on. You know, I have a high school friend who is fighting for his life now with COVID. I have other elderly relatives and friends who have been locked down for a long time, not going out, not having much of a life, not able to see their friends and family over the holidays. And we're just kind of hunkering down to do the best we can. I urge that aggressive testing, aggressive tracing be implemented. Another idea that I have not heard come up is for people who do test positive and who can't go to work, why not give them unemployment insurance? Why not pay them to stay home for a couple of weeks while they're isolating and not infecting other people? I think that would be really huge because there's a perverse incentive that people have to go to work when they're sick to feed their families. And that's just wrong. It's wrong for them. And it's wrong for other people who could be exposed. I also think that we need to fill the gaps in our healthcare system so that we can take care of people. Our discharge experience with my husband trying to find a place for him to go. I called the VA. I called a friend who's a social worker. I worked with the healthcare team at the hospital, and it's just, we have to be able to take care of the people who are sick, even when they get sick. And the mask mandate and the testing and everything else is so important. Early in July, I was trolled on Facebook. People told me to leave the county. I was concerned about personal violence against me because of my activism. And that's just wrong too. So there are so many changes, and I thank everybody for participating and telling their stories and doing the jobs that they have to do to try to keep us all safe and get us through this until we can put COVID behind us and declare victory over it. Thanks, everyone.
Sam, you're muted.
If we have any questions, thank you. Thank you, Ms. Worthington, for sharing your story. If we have any questions for our elected officials or any of our speakers, for that matter, from our media representatives who are with us.
This is Cole with WBIR. I have a quick question for any of the elected officials here. It's a two-part question. One, and you've addressed this already a little bit, but I just want to nail down on this point. How do you think that some of the leaders in charge of this response, the governor, the county mayor, have done when it comes to handling the pandemic? And what would you like to see them do?
I'd be happy to take that, or be one person who takes that. Can you hear me?
Yep, we can hear you.
Okay. You know, as I said, I want to see the governor lead. I want to see the vaccine that got here yesterday. I want to see that go in the arms of health professionals who are waiting on it. We shouldn't have to wait for Thursday, since we have some vaccine here. I want to see a mask mandate. I want to see an increase in testing and not a decrease. And we have got to do contact tracing so that we know the areas of the most spread, and then we can mitigate those things like surrounding states have done when it comes to potentially limiting large inside gatherings, that sort of thing. It's getting cold, people are moving inside, and we've got to adapt to that. And if for a small amount of time, if we have to do some restrictions to save lives in our community and keep people safe, then that's what we need to do. Again, as I said, we are volunteers. We need to step up and volunteer to do all that we can to keep our community safe. Governor Lee needs to lead. He is absolutely not doing that right now. This let things come what may, or it's doing damage in a couple of ways. It's doing damage to people's health, but it's also not creating the consumer confidence we need to make our economy successful. The people I know are not going out. They know which businesses mask and which ones don't, and where they can go safely and where they can't. If we had a mask mandate and it was expected everywhere and it could be enforced, there would be greater consumer confidence to get out and about and get those things you need. But quite frankly, right now, we need to do as little getting out and about as we just desperately need for our families. And I have so much concern for those frontline workers who have to be at work at the grocery store, certainly in the medical field, all of those people. We need to do everything that we can to protect them, because protecting lives also protects livelihoods. And the fact that our governor doesn't see that is a serious problem. And I agree with Katie Allison. It goes beyond partisanship to a complete lack of governance. It's like we're out here on our own right now. We see other states doing better. We know there's a difference. We know that in counties that have mask mandates are in all cases doing better than those that don't. And it's hard to do it countywide because people are crossing counties, especially in Knox, all day long. So the reality is we need state leadership to step up. And the reason we have the number of cases we do, the reason we are #1 in the world right now is because of a lack of leadership from Governor Lee.
Yeah, and I'd like to chime in on that. I agree with Representative Johnson. And, and even if I realize we're all in, we, this August group that you all heard from, we are in the mask camp or in the mask, corner. If the powers that be Mayor, we're in the throes of the Christmas season. Folks are going to get out and about. So for the next 30 days or so, if you could just do that and see what happens. Look at the Thanksgiving surge that we're in the midst of, and that hopefully that will dampen out. But then measure back to data-driven decisions, like everyone initially said that they were for, and let's see. I'm confident that we'll see that they won't go down to zero, but just let's look at that period, and then let's have another discussion. So I wish we would just do a mask mandate, but I realize not everyone thinks like I do, or we do, but just acknowledge that right now we're #1 in a really bad way, or we're close to #1 in several categories in a negative way. Let's do something different. Let's do something that takes us away from that designation.
Do we have any other questions from the press?
Yes, this is Scott Barker with Compass. I've got a question for either Representative Johnson or Representative McKenzie. Have either of you asked the Attorney General for an opinion on whether the Knox County Commission has the authority legally to abolish the Board of Health?
I'll give a quick answer, and that answer is no. I actually just went through my with our freshman orientation last week. General Slater and I did have a conversation about the health condition here in the state, but that question I did not specifically answer, but that's a great question. And I think it should be asked is what I'll say. Probably will be. But Representative Johnson.
I have not done that. What I have done, I have talked to some lawyers within our caucus, and their understanding is that you cannot, when you have an established health board, you cannot, according to our state code, limit their powers at all. But as far as do the disbanding, that I can definitely check on. But I spoke specifically with attorneys about limiting those powers, and they said that according to state statutes, you absolutely can't do that.
This is Isabel with Knox News. Can you all hear me okay?
Yep,
okay.
We can hear you.
Great. So I know you all are calling for a statewide mask mandate. I'm curious if there's any other actions you think the Knox County Board of Health should be doing at this point in time. And this is directed at Representative Johnson and McKenzie.
Well, for me, I want a mask mandate from the state. It would be nice to have one from the county mayor or from the county that would actually be enforced. But I think it's critical because so many people live in Blount or live in Lenoir City, work in Knox County. There's so much crossing of the lines. I think that really needs to come from the state level. And then, as I said, I believe that we should be following metrics for schools, and that we should open, as Representative McKenzie said, based on data, and opening and closing based on what the data says. But I also believe when we are at the level of spread that we are, we should be considering limiting some indoor events and in indoor situations based on the metrics we have, and based on metrics and based on the data, not based on a date, which is what we've done more recently.
Yeah, and just to add to that, I'm a Knoxvillian that works at Oak Ridge National Lab in Anderson. I guess I drive through Anderson. ORNL is actually in Roane County. So I traverse 3 counties to get to work. I'm, of course, working from home currently. But so it does need to come from a higher level. I think what the Board of Health is doing and has done has been very, very responsible. They not, they didn't restrict indoor dining. They just reduced it, and that was based on number. They increased it and they reduced it. So I think this local Board of Health, they're listening. They're listening to the businesses. They're listening to the scientists. They're listening to the government officials, and they're making informed decisions. I don't agree with all of them. I mean, I personally believe if we shut things down for a period of time, totally, I think things will get better. But I like what they're doing. They're taking a measured approach. So that to me, that combined with a statewide mandate to give them cover, to say at least everyone out there has been clearly mandated to wear masks, then I think they're and by they I mean the Board of Health, decisions and processes get a whole lot easier.
And then of course adding more testing and contact tracing, so that we know where the virus is spreading and we know better how to take those actions. Reducing testing is going to be a terrible decision if that's the decision that's made, which was discussed yesterday. So I think that we have got to have a very robust testing and contact tracing system to keep a handle on this, and that testing needs to come back in a reasonable amount of time.
Thank you for those questions. Do we have any other further questions from the press for any of our elected officials here today?
Representative Johnson, could you just clarify which call you were talking about yesterday where they discussed lowering testing?
No, it wasn't a call. I saw that in the press.
Okay.
And I can't remember. I read so much, I can't tell you which one it was.
It was
But-
News Channel 5 out of Nashville was reporting that.
Okay.
All right. Well, one more call for questions. If not, then let's see. Scott, do you have one more question?
I've got one. Yeah. One of the reasons that the Knox County Health Department has scaled back its contact tracing is a slow reporting from the state Department of Health. Their data system is very slow, apparently, in reporting test results back to the counties. Is that something you've heard about? This is for our two representatives, McKenzie and Johnson. Is this something you've heard about, discussed with anyone in the administration?
Our caucus since March has been calling for more hiring of contact tracers. I don't think there was an ad on the website, the state website, for contact tracers until July, as I recall. And so the reality is we never got that program up and running how it should have been during the shutdown and then beyond. Every single step that we've taken, it seems like we get into the middle of a crisis before somebody decides to take action, because we knew in March we needed to be hiring contact tracers and getting that program started. And we knew that it was going to take thousands in this state. And we didn't get that program going. And it's very frustrating that we've never been able to catch up. And now we're to a point where it's just because of the number of the cases, it's almost impossible. It's like the unemployment. When we told them in March, you've got to hire more folks. You have got to beef up this computer system. There's going to be a huge load. They didn't do that till almost June. And by then, people had gone 3 months without getting a check. So the slow response of this governor has been a mess that has made this terribly more difficult for Tennessee families. And it shows.
Matt, this is Cynthia Finch. I have a question for our Representative Johnson and McKenzie. Due to the fact that we are right here in 2 days with the vaccine coming forth to our state, and we do not have an organized communication push out to people on the ground, would you be in favor in supporting initiatives that dealt with aggressive boots on the ground communication to the least of these to get the message out? Because I don't care how much vaccine you get, how much Pfizer produces, Moderna, and all the ones in this trial that I'm in. If we don't begin to educate people from the level of trust down to talking to your Sunday school teacher, they're not going to put that needle in their arm.
No, you're absolutely right. You know, and it's and I know it sounds like a session, because I guess it is. There's a lot of negative tones thrown towards the governor and his office. I just think they weren't prepared, and it's hard to, this is once in a century kind of event. So with that said, once that happens, you really have to be evasive and innovative and dynamic, and that's where I think we've fallen short. As it relates to getting the information out, getting the confidence level there on a vaccine, it should have been done a while ago, and I've been in several meetings, and let's just, from an African American standpoint, we struggle with our history. You know, the Tuskegee experiment still resonates. So there needs to be a clear communication about what the vaccine is, what the vaccine isn't. Definitely going to push for more communication and innovative ways to assure our citizens and our constituents that the vaccine is safe. We use people like yourself, Cynthia, to say, this is a person that went through it successfully. Have a conversation with her. So yes.
All right, we have time for one more question and then we'll need to wrap up, but does anyone have a final question that they'd like to pose? All right, well, if not, I want to again thank all of our public officials for participating today and thank all of our community members who have joined us that have been affected by COVID. And thank you to the members of the press and media for joining us today as well. We'll send a press release right after this with contact info for all of the people on the call if you'd like to follow up with them personally as well. Thank you all very much, and we hope you have a safe and good day.
Thank you.